Arthrex 30-degree scope set, Arthrex shaver, Arthrex camera set. Make sure you have the nut, the stopcock, the sheath, the scope, and the obturator. The scope should have this small screw-on attachment for the light source. To set up the scope, first take out the sheath and the stopcock. You put the stopcock on here and wiggle this down so it fits flush. Then grab the nut and screw the nut on. Does not have to be super tight. Next, we will hook up the scope to the camera. So we pull out our scope and grab the camera. And you thread this on. You do not have to tighten this super tight. Next, we will hook up the light source to the scope. We just grab the end of the light source and push connect. It magnetically connects. You do not have to twist it to connect it. There's a wrench in the camera case. This is used to remove the scope from the camera at the end of the case. The next piece of equipment is the shaver. The doctor will decide what size bit he wants for this. The bit would fit right into here. Next, we'll take a look at the outflow tube set. The outflow tube set comes with a few different tubings. First tubing we're going to look at is this. On it, it says inflow. This piece will unscrew and connect here. This delivers fluid to the joint. The next piece in the outflow tube set comes with this box connected to 3 separate tubings. Each tubing is labeled. This one says cannula, this one says waste, and this one says shaver. The cannula will hook up to the other side of this. This removes water from the joint to make sure the pressure is stable. The red one, labeled waste, will be thrown off the field and hooked up to a Neptune. The clear one, labeled shaver, connects directly to the shaver. Once you have everything set up, we have to throw off the pieces for the circulating nurse to connect. From the shaver, you would throw off this piece. From the camera, you would throw off this piece. From the light source, make sure to throw off the correct end of the light source, which is this. From the tube sets, you throw off this piece and throw off this box and the red tubing labeled waste. Your setup should look roughly like this. Scope with light source and camera setup. Sheath with obturator, stopcock, nut. With blue cannula and the clear inflow tubing ready to be connected. Arthrex shaver connected to the tubing that says shaver. Other instruments you might need. The Storz arthroscopy instruments. The Stryker arthroscopy instruments. The Storz and Stryker arthroscopy instrument sets are the same sets, just different brands. The Stryker cutter accessory set. This has a few additional metal cannulas,